Welcome back. Today, we are taking a comprehensive look at Down syndrome. Whether you are a parent, an educator, or just someone looking to learn more, let's explore. We'll cover genetics, unique ways individuals learn, healthcare guidelines, and a fulfilling adulthood. Let's dive in. First, what exactly is Down syndrome? It is a genetic condition resulting from an extra copy of chromosome 21. This makes it the most common chromosomal disorder in humans. This extra genetic material disrupts normal developmental processes. There are actually 3 types of Down syndrome. About 95% of cases are caused by meiotic non-disjunction. This means there is a full extra copy of chromosome 21 in all cells. Commonly known as trisomy 21, about 3% to 4% of cases are Robertsonian translocations, where part of chromosome 21 fuses to another chromosome. And 1% to 2% are mosaic, meaning only some cells have the extra chromosome. When it comes to learning, individuals with Down syndrome have a very specific profile of strengths and challenges. They are often strong visual and kinesthetic learners and have a great desire to learn from and interact with their peers. They typically excel in social understanding from a very young age. However, they often face challenges with verbal short-term memory, meaning that learning solely by listening can be difficult. To support them, specialists recommend a total communication approach. This method uses speech, manual sign language, gestures, pictures, and voice output devices to prevent frustration and support overall language development. Where should this learning take place? The research is clear. Inclusion matters. Studies show that children with Down syndrome make significantly more progress in academic skills, especially reading and spoken language, when they are taught in fully inclusive general education classrooms, rather than in segregated special education classes. Along with cognitive development, physical development requires early support. Infants with Down syndrome almost universally experience hypotonia, or low muscle tone, and joint laxity. This can delay motor milestones like walking. But early intervention makes a huge difference. Research demonstrates that starting physical therapy before a child reaches 1 year of age has a significant positive effect on both gross and fine motor development compared to starting PT later. Because Down syndrome affects multiple organ systems, staying on top of healthcare guidelines is vital. For instance, up to 50% of infants with Down syndrome are born with congenital heart defects, making an echocardiogram essential in the first few weeks of life. Additionally, up to 80% of preschool children experience hearing loss, and many have vision impairments, which is why annual screenings are highly recommended to ensure these issues don't hinder learning. As individuals with Down syndrome grow older, they face a specific health risk, a greatly increased risk of developing early-onset Alzheimer's disease. By age 40, the brains of almost all individuals with Down syndrome show the plaques and tangles characteristic of Alzheimer's. Scientists believe this is largely due to the extra copy of the APP gene located on chromosome 21, which increases the production of beta amyloid. Despite these challenges, the outlook for individuals with Down syndrome has never been brighter. Thanks to medical advances, the median life expectancy has increased dramatically, from around 39 years in 1960 to about 58 to 60 years today. As they transition into adulthood, young people with Down syndrome are increasingly accessing inclusive post-secondary education, vocational training, and competitive integrated employment. There are even dedicated resources to help them create resumes and pursue entrepreneurship to start their own businesses. And science isn't stopping. Researchers are currently investigating exciting new therapies, such as gene silencing, to see if the extra chromosome 21 can be switched off to balance gene expression. With the right healthcare, inclusive education, and community support, individuals with Down syndrome are living long, meaningful, and productive lives.